While we have long debates, as we should, about Medicare, we devote much less attention to the healthcare system as a whole, where the private costs account for about 50% of total spending. The sad truth is that many of these costs are very excessive and serve as one of the most anti-competitive forces in our economy. Consider this. We spend about twice as much per capita as the rest of the developed world, with health outcomes that are at least no better than our peers. We are racing towards healthcare spending of 20% of our GDP. That would be 7 to 10% more of our GDP than any other developed country spend. This represents 2 to 3 times our total investment in R&D, both public and private. This is incredibly short-sighted at a time when the competitive agenda cries out for far more investment in innovation. There is much we don't know about how to reduce healthcare costs, but too often we don't apply what we do know. Today, I'll give you just 2 examples. The first is our perverse fee-for-service payment system, which along with our medical liability system maximizes volume, not value. The result is that we conduct, for example, more than twice the number of CT scans as Australia and 3 times the number of MRIs as the UK. Unfortunately, we don't yet have an alternative payment system worked out. An example of how we're able to identify solutions but do little to implement them is the egregious and inexplicable variations in cost for medical treatment throughout the country. No business would ever tolerate such variations. A business would shine a light on the variations and figure out how to apply best practices elsewhere. We simply must determine how to incentivize individuals and institutions throughout the healthcare system to do the same. Medicare, because it has access to extraordinarily detailed data on cost, volume, and quality of care patients receive, is in a very good position to reward good performance and penalize bad performance. We feel so strongly about the need to improve value throughout the healthcare system that we are establishing a new Center for Healthcare Value within the Peterson Foundation.